Nicholas Gonzalez, Wikipedia audio. Nicholas James Gonzalez, MD, was a New York-based physician known for developing the Gonzalez regimen, an alternative cancer treatment. Gonzalez's treatments are based on the belief that pancreatic enzymes are the body's main defense against cancer and can be used as a cancer treatment. His methods have been generally rejected by the medical community, and he has been characterized as a quack and fraud by other doctors and health fraud watchdog groups. In 1994, Gonzalez was reprimanded and placed on 2 years probation by the New York State Medical Board for departing from accepted practice. In one non-randomized clinical trial of terminally ill patients with pancreatic cancer, the Gonzalez-treated patients were found to have died much earlier than those treated with conventional chemotherapy. A better quality of life was reported by the chemotherapy arm. Gonzalez was born December 28, 1947 in Flushing, New York. He graduated Phi Beta Kappa and magna cum laude from Brown University, with a degree in English literature. From 1970 to 1977, Gonzalez worked as a journalist for Time Incorporated and as a freelance writer, covering a variety of health-related topics, including a July 1972 cover story in New York Magazine, a 1976 cover story for Family Health Magazine, and an article for Prevention Magazine. Gonzalez became interested in medical research, cancer research in particular, while covering these topics. Biography. Gonzalez completed postgraduate pre-medical work at Columbia University and received his medical degree from Cornell University in 1983. Gonzalez worked with Robert A. Good at Memorial Sloan Kettering Cancer Center while in medical school. After receiving his medical degree, Gonzalez completed an internship in internal medicine at Vanderbilt University. From 1984 to 1986, Gonzalez worked with Good again, completing a fellowship in immunology while at University of Oklahoma and All Children's Hospital in St. Petersburg, Florida. Gonzalez died on July 21, 2015 at age 67. Gonzalez's treatment methods, which he's been using since 1987, are developed from previous work by the orthodontist William Donald Kelly. Gonzalez believes that cancer is caused by poor diet, a problem compounded when one does not eat a diet that corresponds with one's metabolic type. Environmental pollution and daily stress contribute to health problems. The Gonzalez regimen proposes as a treatment a cure-oriented change in lifestyle and nutrition, the use of oral pancreatic enzymes, large numbers of dietary supplements and twice-daily coffee enemas. According to the National Cancer Institute, which co-sponsored with the National Center for Complementary and Alternative Medicine, a clinical trial on Gonzalez's treatments produced limited and inconclusive results regarding the efficacy of the Gonzalez regimen as a treatment for cancer. In 1999, Gonzalez published an article describing prolonged life in a small group of patients with pancreatic cancer in the peer-reviewed journal Nutrition and Cancer. Subsequently, others concluded that the longer survival time reported by Gonzalez was due to selection bias and other confounds. Like his mentor, William Donald Kelly, Gonzalez's treatment method has been rejected by the medical establishment. Gonzalez has been characterized as a quack and fraud by other doctors and health fraud watchdog groups, and in 1994 was reprimanded and placed on 2 years probation by the New York State Medical Board for departing from accepted practice. Forced to submit to psychological examinations and undergo retraining, Gonzalez was given 2 years of probation with a stipulation that he undergo retraining and do 200 hours of community service, which he completed satisfactorily. He was fully licensed to practice in New York. Gonzalez has lost 2 malpractice lawsuits. In 1997, a New York court found Gonzalez negligent for his cancer treatment. According to news reports, Gonzalez had to pay $2.5 million in damages to a patient he wrongly claimed to have cured of cancer. The former patient had been diagnosed with uterine cancer, but Gonzalez discouraged her from following through on her cancer specialist's advice, instead recommending dietary supplements and frequent coffee enemas. The patient had refused both standard treatment and an experimental protocol, but after the cancer spread to her spine, she discontinued Gonzalez's treatment and received chemotherapy and external beam radiation. Sometime in this period, she began having problems with her eyesight, back and hip, and she eventually became blind. In 2000, Gonzalez was found partly liable in the death of a patient with Hodgkin's disease and ordered to pay $282,000 in damages, due to his use of an unproven cancer screening method instead of standard cancer testing. The American Cancer Society notes that there is no convincing scientific evidence that is effective in treating cancer and that some portions of the treatment may be harmful. A review article from the Journal of Clinical Gastroenterology is cited that notes the clinical efficacy of coffee enemas has not been proven and the therapy is associated with severe adverse effects previously described in a few case reports. Gonzalez's study, published in Nutrition and Cancer in 1999, was criticized by an expert in integrative oncology research methods for its small sample size, selection bias, and failure to account for confounding variables. Gonzalez has never explicitly rejected the more orthodox precepts of his profession, insisting that he wants his research evaluated by independent scientists. A randomized Phase 3 clinical trial for the possible treatment of pancreatic cancer with the Gonzalez regimen was funded by a $1.4 million grant from the National Center for Complementary and Alternative Medicine, NCO, sponsored by the National Cancer Institute, awarded in 1999 to Columbia University's Rosenthal Center for Alternative Medicine. The trial was designed to compare the efficacy of pancreatic enzyme therapy plus specialized diet with gemcitabine for stage 2, stage 3, or stage 4 pancreatic cancer. However, the study had difficulty attracting patients, and most eligible patients refused random assignment, so the trial was changed in 2001 to a controlled, observational study. Cancer treatment and its effectiveness. The trial found that patients treated with the Gonzalez regime survived on average for 4.3 months, those using standard chemotherapy survived on average for 14 months and reported a better quality of life. An accompanying editorial said it was troubling that expensive chemotherapies were not backed by firm evidence, and that the trial of the Gonzalez regimen was not capable of providing a definitive conclusion because of flaws in its design. Kimball Atwood said that flaws in the trial design might have led to bias in favor of the Gonzalez regimen, but that it nevertheless amounted to a slam-dunk condemnation of the therapy. This trial had been criticized for its implausible and unsupported theoretical model of cancer development, which bears no resemblance to the scientific understanding of neoplasia, and because of Gonzalez's history of malpractice. Rejection by mainstream medicine. Clinical trial. Publications.